Good afternoon. Tim Bennett here from the Cortland Voice. I'm here with Alex from Family Counseling Services. Today, Alex is educating the community about, drug prevention and things like that. Alex, can you tell the community what's going on?
Yes, definitely. Thank you so much for having me on. So we're doing a Narcan training today. It takes just 5 minutes. We're over at the Econo Lodge. So we train people in how to respond to an opiate overdose, save a life. So why don't you come on in so we can talk more privately about all the good work that we're doing, trying to reduce the overdose death rate by 30% in the next 3 years.
Okay, let's go on.
So this is our mobile office that we can take it to the person. So we met people in the park, in the, their garage, wherever. A lot of people don't really want to talk in front of all their loved ones.
And what I'm going to do real quick is I'm just going to lower this, so just in case anyone's talking to someone outside of this, they can't see it outside.
Sounds good. Perfect. Yes, confidentiality is a huge thing for us. We want to make sure that, people feel comfortable and safe. Because drugs and problematic use are a problem that's across our spectrum. So it doesn't matter what your gender, age, racial background, religious background. We have too many people that are struggling.
Financial too.
Yeah.
Anyone.
Yeah, exactly. You can be the poorest person that's homeless. You can also be the richest person that it looks like everything's fine on the outside. And actually you're not. So there's been a really high overdose rate in Cortland County for a while. Last year was astronomically high. All the final numbers have to come in. But we're a part of this larger group called Healing Cortland. So there's a study that's across several states and multiple counties looking at how do we reduce that overdose rate. Because we're just losing too many people. Too many family members, friends, parents are, mourning the loss of someone that's really important to them. So today we're doing a really simple thing, just training people in Narcan. It's no cost to them. It looks like this. It's really simple, just a nasal spray. You take it out of the package, you put it in their nose, you press the red plunger. And we're giving them out free, no questions asked, because it all comes from the state. And we just want to make sure that, people have a second chance.
Okay. So I'm going to start asking you a couple questions.
Sure.
So if someone cannot get down here, once again, you're on the Econo Lodge, which is on Church Street in Cortland.
Correct.
Like basically diagonal from Courthouse Park.
Yep.
If they cannot get out here between now and what time?
2:30.
2:30 today. How can they reach you? I know you're on social media, but is there a phone number? Is there a website? Like, let's give people multiple ways, just in case they see this later. I want them to be able to contact you.
Definitely. So so we are here until 2:30 today.
Okay.
We are also as you said, on Facebook. So both Family Counseling Services and Healing Cortland. We have Narcan Zoom trainings twice a week. So on Mondays at 3 and Wednesdays at noon. You can also call our office, which is 607-753-2034. You can also stop by at 65 Main Street across from Daily Grind South between 9 to 5. Get a quick training. I'll walk away with a kit. Okay,
so let me ask you this. How long have you been doing this, and how long has your agency been around, would you say?
Yeah, so Family Counseling Services, which is now Family and Children's Counseling Services because we're doing the rebranding, has been around for 4 or more decades. Really passionate about trying to get people the help they need. So this is part of the outreach effort. So we bring the clinic outside of the clinic. So if somebody, came up today and wanted to go to detox or wanted outpatient, we can talk to them. If there's a place they can go and they want to go, we'll put them in the car and drive them there. We also have mental health treatment and substance abuse. Cortland Prevention Resources has the LGBT Center and many programs for parents and kids, and trying to get people just to be more aware of the risk of problematic use early on.
Okay. My next question. So, almost about a week and a half, maybe around a week or so ago, we did an article, and off of what we were given from City of Cortland officials, they said 3 people overdosed within 12 days, basically starting this year. What would you say right now your agency is doing differently, as in like marketing and to get in front of people? Because, being a pandemic, you're masked. I'm wearing a mask.
Yeah.
It's different than it was before. How are you getting in front of people? How are you being effective? Like, what has changed? Maybe, hey, we used to do this, we don't do this anymore. Like, what have you changed? Because, like, it seems like we need to find the answers, and we need to do it immediately because people need change. People are upset. People don't want to see anyone die anymore.
Yes.
It's a lot. No one wants. We need to take care of our community. What are you doing?
Yeah, so our commitment to the community has not changed. The nice thing about the pandemic is that telepractice was allowed. So clients being able to, instead of having to find a ride, come to our office, talk to our worker, they're able to do it over the phone. They're able to, both to call in and to use a platform called Zoom, so they can actually see their counselor. The counselor can, share things on the screen, like here's tips about how to calm your breathing, or here's some resources. We're still doing some in-person things because some things just need to be in person. And we're still able to, drive people to treatment, help people get connected. Because as you said, we keep losing people, and we keep having so many people that are struggling with their problematic use, so they're not able to be the best version of themselves for their family, for their friends, for their jobs. And so we all really need to band together. So Narcan for us really started taking steam probably within the last year, and we started having these pop-up events. So last month we were at the county office building. This month we're at the Econo Lodge. We're looking for future sites both in the rural part of our community and more in more of the population centers as well. So if there's any business or organization which is comfortable with us, just hanging out in their parking lot for a couple hours and trying to give away some free medication that will help save lives, that would be a really great help to us.
Okay. And is there anything else that you would like to say to the community to close out this interview?
Yeah, so just that recovery is possible. We get to see it every day, that people are making different choices and getting their life back on the track that they want to be on. So please feel free to reach out. There's so many lovely local resources here. And if you need help, give us a call. If you want to follow us more, like us on Facebook, because then you'll know more about resources and events that are happening. And just take care of yourself. Life was hard before the pandemic, and now life is so much harder. And so try to do something every day to take care of yourself. And thank you so much for this opportunity to kind of share the information with the public.
Thank you again. Have a great day.